Get you with that one? Hope you brought your umbrellas, because it's about to rain knowledge in here. We're going to get into the orientation of the body, the terms, the planes, and the directional values. Buckle up. Okay, so what you see here is something called the anatomical position. And this is how all orientation is referenced through all medical terms. They always assume the patient is in anatomical position unless noted elsewise. You will notice that anatomical position is as follows. The person standing, erect, straight up, face, palms, feet, all forward. All right? Palms forward is this, meaning supine. If they're pronated, they're this way. So anatomical position supine is like this, like you're holding some soup. More, please. Okay, soup. Supine. All right, that's the anatomical position. So if I ask you to say, hey, get an anatomical position for me, you should be able to do like, boom, stand there just like that. Here are many of the terms that we need to know for the regions of the body. All right, and you'll notice that they all have little points sticking to them, and they're not called nose or chin or eye or whatever it might be. You'll notice that frontal is the front here. Orbital, eye. Nasal, buccal, oral, mental. All right, that's the chin there. Cervical, neck. There's 7 cervical vertebrae. We'll get to that later. Acromial, point of shoulder. Deltoid, brachial, antecubital, antebrachial, carpal. You'll see that all the terms are listed for you here. You're going to have to know every single one of these. All right, here is the rear region. And the rear is known as the posterior. All right, posterior or dorsal region. If you're a fish and you have a fin on your back, you're called the dorsal fin. You can remember it that way. I'm looking at the back, I got a dorsal fin. Well, I don't have a dorsal fin, but I could. So acromial again from here. The back of the elbow, olecranon. All right, some people call it the weenus. It's not a thing, okay? It's called olecranon. Don't be going around saying weenus. Doesn't make you sound smart. It's not it. All right, femoral thigh, popliteal, sural calf, calcaneal, plantar. All right, gluteal, sacral, lumbar, vertebral, scapular, occipital. Got to know all these terms. I got to know them all. All right, this is why the anatomical position is important. All right, it allows us to explain where one's body part is in relative orientation to another. Our anatomical terms save words and are less ambiguous, meaning they get people less confused. If you start in the anatomical position and I flex my left antecubital, everyone knows I'm going to flex my left elbow. Okay? And it's always the patient's left. Not yours where you're looking at me. Always the patient's left and right. Okay, now here's some directional terminology. If things are called superficial, it means they are at the first layer or the outside layer of the skin. Just like if a person is superficial, they only care about what's on the outside. So a superficial wound would be like a scrape. All right, the other one for something that's really deep inside the body is called deep. It's not that technical, but it's deep. Now, I don't know if you have your textbooks yet, but when you do, these diagrams are in the textbook, but this is also found on Canvas, so you can reference these anytime that you want. So superior is toward the head. All right, organisms that have heads have cephalization, which is what cephalad means here. You see that right here? Cephalad means having a head. So superior is toward the head. Inferior is away from the head. That's right here. Ventral is toward the belly. And dorsal, which we just saw from the other view, or posterior, means toward the back. These are pretty simple. You should be able to remember these. Okay, a couple more terms here. Medial means toward the middle. You should be able to remember that. Midline medial. Lateral is toward the side or away from the midline. And if you move laterally, you're moving to the sides. You can remember that. Intermediate, between a more medial and a more lateral structure. The collarbone, which is known as the clavicle, and I hate that your textbook used collarbone, is intermediate between the breastbone, which is called the sternum, and the shoulder, which is called the scapula. So I'm not sure what they're doing there. All right, proximal is close to the origin or body part you are talking about. All right, proximal is close to. Distal is far from, to the furthest part from whatever you're discussing. The knee is distal to the thigh. All right, the phalanges are distal to the acromial. And again, for directional terms, right and left refer to the subjects or the patient. Okay, you're the medical physician. You're looking at the patient. It is their right and their left. It is not your own. All right, you have to remember that. That gets people messed up all the time. Because when we do dissections, I'm going to tell you to make a cut on the subject's distal phalange, and you're going to be like, which side? Okay? Now, when we talk about body planes are important for how things are cut or imaged. And MRI, CAT scans, you can set those to cut along the body images that you're looking for when you become a medical professional, or if you're interested in that. Or if you can see a CT scan and figure out which way it was cut. A plane is an imaginary flat surface that separates two body portions, or an organ. A section is a resulting cut along the plane of the body. And I'm going to go through some planes right now with you. The sagittal plane is a vertical plane, up and down, that divides the body into unequal right and left portions. Look at the diagram here. Okay, that's not cut right down the middle. It's cutting a shoulder here. So maybe they're looking for a shoulder injury and they set this MRI or CAT scan up to cut about 10 slices here to see something wrong inside the shoulder. The mid-sagittal is right down the middle. Mid-sagittal, the median. The plane passes through the midline, dividing it into half as it separates it into right and left. Transverse or horizontal plane. Right down the middle here, but running horizontally. Separates it into inferior, which is below, and superior above. Remember, superior means toward the head, inferior is away from the head. So you've got a superior region and an inferior region below. The coronal or frontal plane looks like the other one, except for now from here, it's turned. It cuts you that way. Right down the middle there. Separates it into anterior and posterior. Remember, a front portion, which you see here, and the back portion, which would be right around here. This is an interesting diagram here. This notes that ventral and anterior are not synonyms. They do not mean the same thing. Ventral means belly and anterior surface, and anterior is face and chest. And it's tough in the human because that's all located right here. But if you're looking at the dog over here, all right, the anterior is here, but his belly is way underneath here. And his posterior is back here, and his dorsal is on back. So for the human, it's different because we're bipedal and we stand up on 2 feet. But if you were to go down onto all fours, like the dog here, it'd be much easier to figure out, where the ventral and anterior would be. All right, this is something you have to remember as well.